Personnel. Thank you for coming to the interview today.
Hi, thanks for having me today.
Okay, let's get started. What areas of nursing are you interested in and why?
I currently work in mental health, and I enjoy that area of nursing. I also enjoy working in the ER.
Okay. Tell me about your clinical experiences. Which rotations did you enjoy most, and why is that?
I did rotations in mental health at a local state hospital. I also was at an inpatient hospital that I worked on the pediatric unit there. I enjoyed both of those rotations as well. And I also spent some time in the ER, which I enjoyed that. That's an area that I was not comfortable in, but I have learned to work well there and to adjust to the atmosphere and able to get that experience well.
Okay, good. What is the biggest mistake you've ever made, and how was that problem resolved?
When I worked many years ago, after I first got my LPN license, I was a fairly new nurse then. I had a med error in the nursing home one night on night shift. I had given the patient the incorrect dose of medication. I had called the director of nursing and made her aware. I did make the family aware, the doctor aware. It was not a huge mistake, but it was still an error, and everything was fine. The patient was fine even after the error was done. But it was a learning experience, and I felt that it was handled very well.
Good. What do you see as your strengths, and why is that?
I feel that I'm a team player, a hard worker, and I feel that I am able to help others when asked, and if they need anything, I'm always willing to go the extra mile when needed.
Okay. What about your weaknesses?
I feel that I'm very easily emotional. Sometimes that's not a good thing, especially when you're dealing with patient care. That seems to be, I think that would be my weakness that I would have to say.
And can you tell me about a staff nurse who most impressed you and why?
There's been so many nurses that have been helpful and very impressive, hardworking nurses. The nurse that I'm worked with currently this semester in my rotation, she is absolutely super. She's very hardworking. She knows her stuff, and she's able to get things done. So I've learned a lot from her, and I feel that she is a very good nurse and very excellent person to learn from. So she's been very helpful, and she's a very helpful learning experience for me.
Okay. How would your most recent nursing instructor describe your performance in the clinical setting?
I feel that they would say that I'm very eager to learn, able to jump in and perform skills when needed, able to get the job done with little or no assistance needed there.
Okay. Tell me about your most challenging clinical assignment and what you learned from it.
I think my biggest clinical assignment that I've had was going into the ER. That was very much out of my comfort zone because it was an area of nursing that I had never felt that I was interested in. But I have learned that I feel like that's an area that I would be able to work in. I've learned a great deal from the doctors and the nurses there, and I feel that I've learned just a lot there, and I feel much more comfortable there now than when I first went in.
Okay. Tell me a little bit about yourself, and how would others describe you?
I'm a mother. I have 2 boys and my husband. We have a home here locally, and I think others would describe me as compassionate, hardworking, team player, the go-to person. If they need something, I think they feel like they can come to me, and I'm usually willing to get things done.
What are your future career plans, and where do you expect to be in 2 or 3 years, or maybe 5 years?
I plan on working in mental health. I don't intend on going elsewhere. I enjoy that. In 2 years, I hope to have my RNBC, which is the board certified certificate for RNs in the mental health field. And I am planning on taking over the prescription drug monitoring program that we have to have implemented, and I'll be doing some therapy with kids and adults.
Right now, we do not have any openings at the present time in the area in which you have indicated an interest. Would you be willing to accept a position in any other area, and if so, what areas interest you?
I would be interested in another area. I like to work in the ER, so I think that would be an area that I would feel comfortable in. I've also done some work in the nursing home. I enjoy working with the elderly as well, so I think any of those areas would be interesting for me.
Okay. Tell me about a time when you had to establish priorities during one of your clinical experiences.
During assessments, I had to establish priority and figure out the level of care for patients needing in the ER. In the ER, the nurses there also are able to do some protocol orders that they can do without the doctor's order. So we had to make a decision whether those could be ordered prior to the doctor seeing them, or if we could just wait until the doctor evaluated to do some orders.
And tell me about a time when you went out of your way to assist a family or a patient, even though you really didn't have the time.
Currently at my job, I am taking time out of my day to help a 7-year-old boy learn potty training. He's struggling with that, so I'm working with him a couple of times throughout the day to get him to use the bathroom and how to clean up after himself when he's done. So I feel that that's something that I don't have to do, but I'm working with him with hopes that he will learn to go to the bathroom without any help. So that, I think, is something that I'm going out of my way to do.
Okay. Well, very good. I believe you've answered most of my questions. Do you have any questions for me?
Yeah, I would like to know what the time frame is for you to make a determination on the job.
Okay, we're looking at probably in the next 4 to 6 weeks.
Okay. Will I be notified by mail or phone?
Probably email is usually how we contact our prospective applicants.
Okay. All right. I hope to be hearing from you soon, and I thank you for the opportunity, and look forward to hearing and possibly seeing you in the very near future.
It was good to meet you, and thanks for coming in today.
Thank you.